Have you ever wondered if the habits that felt harmless in your younger years might be stressing your body now? Especially when it comes to masturbation after 60? Many men tell me the same thing. They say, "Doc, I thought things like this were supposed to be simple. Why does something that once helped me relax now leave me tired, uncomfortable, or even worried?" If you've ever felt that way, you're not alone, and you're not doing anything wrong. But your body does change with age, and the way you approach sexual activity needs to adapt with it. What surprises many older men is that a few quiet, unnoticed habits can slowly affect confidence, prostate comfort, energy levels, and even sleep. Not because the activity itself is harmful. In fact, it can support circulation, mood, and overall well-being, but because certain patterns create tension or inflammation that your younger body used to tolerate. So today, I want to talk to you directly. You'll learn the 7 masturbation mistakes men over 60 commonly make without realizing it. And more importantly, you'll understand how small, gentle adjustments can protect your body, support your confidence, and keep your sexual health strong in a way that respects your age and your energy. No shame, no judgment, just clear guidance. Because when you understand what your body needs now, you don't have to feel confused or frustrated anymore. You can feel comfortable, informed, and connected to yourself again in a healthy, safe, and confident way. Let's start by understanding why these mistakes happen in the first place. As you move through your 60s and beyond, your body begins to speak a little differently. You may notice changes you didn't expect. Maybe sensitivity feels different, maybe arousal takes longer, or maybe the recovery afterward feels heavier than it used to. These shifts are normal. They're part of aging, just like changes in energy, sleep, digestion, or joint comfort. But when it comes to sexual health, many men don't talk about it. They keep their questions to themselves, even when something doesn't feel right. And silence often leads to worry. What happens next is subtle. You might keep your old habits because they're familiar. You might push your body the same way you did at 30 or 40. And without realizing it, those habits may put pressure on the prostate, strain pelvic muscles, or trigger irritation that lingers long after the moment is over. This is where frustration begins. You might feel more tired than relaxed. You might feel soreness instead of satisfaction. Or you might notice your desire fading and wonder if something is wrong with you. But the issue isn't you. It's simply that your body now needs a different kind of care. Ask yourself this for a moment. Have you ever forced yourself to finish quickly because of stress or habit? Or skipped warm-up thinking it didn't matter at your age? Most men nod yes when I ask these questions in my clinic, and they're relieved when they learn that small changes can prevent discomfort, protect prostate health, and support stronger, more natural arousal. Because sexual well-being isn't about being younger. It's about understanding your current body. It's about confidence, connection, and comfort, not performance. So before we talk about the 7 mistakes, remember one thing: nothing here is meant to embarrass you. This is about giving you the knowledge you deserve so you can enjoy your body safely without stress or confusion. Now let's go through the 7 mistakes I see most often in men over 60. They're simple, they're common, and every single one of them is fixable. Think of this as a gentle guide rather than a list of faults. Your body isn't failing you. It's simply asking for a different approach. 1. First, rushing through the experience. Many older men tell me they feel they need to get it over with quickly. Sometimes it's due to habit. Sometimes it's because they fear losing their erection. But rushing actually increases tension in the pelvic floor. Over time, this can lead to soreness, fatigue, and reduced sensitivity. When you slow down, your blood flow improves, your muscles relax, and your nervous system shifts from stress to comfort. This often leads to stronger, more sustainable arousal, not weaker. Don't worry about timing. Your body responds better when it's not under pressure. Give yourself the space to enjoy the process without forcing an outcome. 2. Second, using too much pressure or a very tight grip. This is one of the biggest hidden mistakes I see in men over 60. A younger body can tolerate a strong grip, but with age, skin becomes thinner, nerves become more sensitive, and circulation slows. A tight grip can create micro-irritation, numbness, or temporary erectile difficulty. Think of it like this. If your hands get tired or your skin feels sore afterward, the pressure is too strong. A lighter, more relaxed touch supports healthier circulation and protects the delicate nerves in the area. Your goal isn't force. Your goal is comfort and sensitivity. Third, ignoring lubrication. Dryness becomes more common with age, not just vaginal dryness for women, but skin dryness for men as well. When lubrication is skipped, friction increases. Friction leads to irritation, and irritation leads to inflammation, which can affect the prostate and the penile skin. A small amount of lubrication makes a huge difference for comfort, sensitivity, and recovery. It reduces stress on the skin and allows the entire experience to be smoother and safer. It's a simple step, but it protects the body more than most men realize. Fourth, using the same technique. You used at 30. Your body is not the same as it was decades ago. That's not a weakness. It's a natural part of aging. But many older men keep the same rhythm, speed, or pressure they used in their younger years. When the body changes, your technique needs to adapt. Sometimes slower movements help blood flow. Sometimes more gentle stimulation creates stronger arousal. Sometimes alternating patterns prevents overstimulation or numbness. Ask yourself, does your current technique actually feel good for your body today? If not, give yourself permission to explore different approaches. This isn't about performance. It's about supporting the body you have now with respect and awareness. Fifth, masturbating. When you're tired or stressed. This seems harmless, but it matters more as you get older. When you're tired, your nervous system is already strained. When you're stressed, your pelvic floor tightens. Both of these make arousal more difficult and recovery slower. Many men say they feel drained afterward, not relaxed. That's usually because the body wasn't ready for stimulation. Instead, choose moments when you feel calm, when you feel rested, when you're not forcing yourself to relieve tension, but instead supporting your own comfort. A relaxed nervous system leads to more enjoyable and healthier sexual activity. Sixth, ignoring prostate discomfort. After 60, prostate changes become more noticeable. You might feel pressure, lingering ache, or a heavy sensation afterward. Many men ignore these signs because they assume they're normal. But discomfort is your body's way of communicating. This doesn't mean you should stop sexual activity. It simply means you need to adjust intensity and frequency. Some men benefit from gentler sessions. Some need more time between sessions. Some feel better after reducing pressure on the perineum. If your prostate consistently feels irritated, your technique needs to change, not your confidence. 7, finally, using masturbation to replace emotional connection or self-care. As we grow older, intimacy can shift. Loneliness becomes more common, stress feels heavier, and masturbation can become a quick escape rather than a healthy part of life. There is nothing wrong with self-pleasure. It supports circulation, mood, sleep, and hormonal balance. But when it replaces emotional needs, it can leave you feeling more tired or disconnected afterward. Balance is key. Make sure you're caring for your body, your mind, and your heart. Your sexual well-being is part of your overall health, not separate from it. A gentle reminder: none of these mistakes mean something is wrong with you. They simply show that your body deserves a different kind of attention now. When you understand these changes, your confidence improves, your comfort increases, and your relationship with your body becomes more peaceful and satisfying. You don't need complex routines. You just need awareness, patience, and small adjustments that support the reality of aging, not fight against it. Let's take a moment to bring everything together, because when you understand why these changes happen, you can move forward with confidence instead of confusion. As you age, your body becomes more sensitive, not weaker, just more responsive to pressure, pace, and stress. The 7 mistakes we discussed aren't signs of failure. They're simply habits that no longer match what your body needs at this stage of life. You learned that rushing places tension on the pelvic floor and makes arousal harder, not easier. You learned that a tight grip, something many men never think about, can cause nerve fatigue and temporary erectile changes. And you now know that lubrication is not an optional step after 60. It's a form of protection for the skin and the prostate. We also talked about technique. Your old patterns may not match your current rhythms, and that's okay. Your body is evolving, and your approach can evolve with it. Adapting your technique isn't about slowing down your life, It's about respecting your biology. Then we explored how tiredness and emotional stress affect the nervous system. Many older men push through exhaustion without realizing it compromises both pleasure and recovery. Your body responds best when you give it calmness, not pressure. And finally, we addressed something deeper. Masturbation is healthy. It supports circulation, hormone balance, and emotional well-being, but it shouldn't become the only source of comfort or self-care. Your emotional health matters just as much as your physical health. So here's the core message I want you to remember. Your body is not working against you. It is guiding you. These changes are natural, predictable, and manageable. And with small adjustments, you can protect your prostate, improve sensitivity, and enjoy a healthier, more comfortable relationship with your own body. Always listen to what your body tells you. If something feels off, slow down. If something feels good, honor that. And if you ever have concerns, you're not alone. Reach out to a trusted health professional. Aging doesn't diminish your sexuality. It simply invites you to approach it with more awareness, more patience, and more self-respect. Thank you for spending this time with me today. Your willingness to understand your body, especially at this stage of life, says a lot about your commitment to your health and your confidence. Remember, these changes are normal, and with the right awareness, you can support your sexuality in a way that feels safe, comfortable, and deeply authentic. If today's lesson helped you, I invite you to stay connected. I share videos just like this one every week. Gentle, clear, doctor-led guidance designed to help you age with strength, ease, and knowledge. So if you'd like more support for your prostate health, energy, intimacy, and overall well-being, consider subscribing to the channel and turn on notifications so you never miss the information your body may need. You deserve clarity, not confusion. You deserve comfort, not worry. And you deserve to feel confident in every part of your health, including your sexual health. Thank you for being here, and thank you for taking care of yourself. Take care of your health, and I'll see you next time.